Good morning. Welcome back to Better Preparedness. This is day 6 of South Africa's lockdown for the coronavirus. This material, it's really global. We're all in this together and we're all going through this. You either call it a lockdown or social distancing, heavy social distancing, whatever you want to call it. We're all in this together. I wanted to give you a bit of an insight into my work in emergency management and how I analyze things. This coronavirus is similar to what you would have in a mass wildfire scenario, like in parts of northern Canada and what we saw in Australia outside of Sydney. Now, from an emergency management perspective, you analyze things a certain way. And what you're looking for are encouraging signs where you need to change your course of action and so on. For this virus, I wanted to talk about a couple different things. I'll put a fascinating link below to an interview between South Africa's Trevor and Dr. Anthony Fauci, who's a communicable disease specialist. A fascinating interview, and that gives you an insight. It also gives you some of the reasons behind why we're doing certain things for this crisis, why they're advocating that we take certain actions. And it really, really helps put it into perspective. Because when you work in emergency management, you turn to those subject experts. And in this case, we're talking about a virus. So you have to turn to those experts. If this was a wildfire, you'd be turning to a fire specialist. So it's really interesting to see their insight and what gives them optimism, what gives them concern. There's a website maintained by Johns Hopkins University right now that has gotten a lot of attention. It's fascinating. It's a map of the world and it shows the cases and the hotspots. And I've been following this for months. And what we saw initially was where the growths were, where initial cases started popping up. And in the last month or so, there's been such an expansion of the coronavirus worldwide. It gives you insight into the growth globally. But all that growth is happening at a country level and at a local level. And you need to look at those country numbers. Because if you look at the main website, it still shows a very, very strong climb. And it doesn't show any leveling off. But again, countries are at different stages of this crisis. China was at its, that was the sort of epicenter initially, and then you had South Korea, and then you had that switch over to Italy and parts of Europe. And it's taken time for the virus to move around and really get a foothold in those various places. So you need to look at the country maps, because that for me is what shows me, are we making progress? There's differences in testings, and you have to be careful between comparing the numbers of a place like South Africa and a neighboring country like Zimbabwe or parts of Europe. Every country has different abilities financially and also their medical systems to do testing. Some countries have a big backlog. So take every number you see on these types of charts with a big grain of salt. Use it as an approximate, but keep in mind that many countries, especially poor countries, really underdeveloped countries, will have an inability to do testing. So we're going to be guessing to a large extent. And you have to apply that when you're looking at the numbers. You can't just take two countries and compare them equally. Some of them started their infection earlier, some later, some started action earlier, later. The United Kingdom was slow to take action, the same for the United States. And so it's going to take time for those numbers to change. But those numbers are what I'm looking at right now. We know for a fact that South Africa implemented the lockdown. So now we have to wait and see. We have to wait for those cases to surface. Hopefully those cases to be tested and identified, and then those cases to hopefully dead end at that location. If there hadn't been this, I think you would have had a continued expansion of people infecting others. And that's part of the reason for this lockdown, is to just hopefully put at a dead end those roads that were now being built of infections sprouting off. And we have to be cautious about not becoming complacent, saying, okay, it's been 6 days of lockdown and we should feel free to go out and start doing various things. We still don't know for sure who actually has the virus. Again, some people are not really showing symptoms, and so they can be infecting others without knowing it. That's why you have to, in my opinion, this 21-day lockdown is a very good way to do it. Is if you don't do it long enough, you don't allow those cases to kind of sprout and then be contained. And that's what we don't want to do right now, is we want those cases to hopefully get resolved with people getting better at home without any outside assistance, or if they need hospital assistance and specialized care, then they hopefully can get that by a still functioning medical system. Please Don't get complacent. Don't become just relaxed about it. Keep washing your hands. Many of these surfaces could still be contaminated that you touch. So really continue to do everything that we're being told to do. Again, when it comes to taking the measures, sitting tight, we will get past this. I am confident. I think the actions that we're taking are good. Now the question is everyone participating, and are all the countries doing what they need to do or what they could be doing? And hopefully that curve is going to sort of level off of new growth rates. But then we need those people to recover, hopefully, and with the most minimal number of casualties possible. But it really is going to be important to keep those numbers leveled off and then getting better. But also, if countries don't participate or they're slow to participate in actions, you have those countries that can be the second wave or the third wave of infections. So really, everybody, let's try to pitch in and do our part so that we can all start recovering. We can get these economies back on the road. In the comment section below, well, how are you finding the measures in your country? Are you here in South Africa? Are you in Canada? Wherever it is. What are the measures like for you right now? Do you feel that they could be more strict? What do you think about that? And how are you coping with these lockdown measures? Okay, thanks for watching Better Preparedness. If you like this episode, make sure you click that like button and the subscribe button plus the little bell so you don't miss any other episodes. Thanks for watching Better Preparedness. Keep well, wash your hands, don't touch your face, keep your distance.